Welcome to Franciscan Health. I'm Ben Seiden and I'll be your moderator for this joint replacement seminar. Our speaker for this session is Dr. Timothy Williams of Franciscan Health's Center for Hip and Knee Surgery in Mooresville, Indiana. I will introduce him in just a moment. Dr. Williams has put together an excellent presentation for us, so if you have a question that his presentation does not answer, just send it to my email at seminars@franciscanalliance.org. Again, seminars@franciscanalliance.org. Now let me introduce you to our joint replacement surgery team. Franciscan Health offers convenient locations for joint replacement surgery. In central Indiana, in northern Indiana, and in south suburban Chicago. Franciscan Health's joint replacement surgeons are some of the best in the Midwest. And I'm proud to announce that the Center for Hip and Knee Surgery in Mooresville, Indiana, has recently been recognized by CareChex as one of the best joint replacement centers in the nation. As the top joint replacement center in Indiana, the Center for Hip and Knee Surgery is a leader in joint replacement and a proud member of the Franciscan Health family. Our presenter for this session is a top-rated surgeon in his own right, and a member of the prestigious Center for Hip and Knee Surgery in Mooresville, Indiana. Having performed over 5,000 joint replacement surgeries since 2006, this board-certified surgeon was an Indianapolis Monthly Magazine top doc in 2017 and is an orthopedic surgery fellow. Dr. Williams truly is a leader in his field and a real expert in joint replacement. It is my privilege to welcome Dr. Timothy J. Williams.
Good evening. Thank you all for coming. My name is Dr. Timothy Williams with the Center for Hip and Knee Surgery in Mooresville, Indiana, and I'm here to talk to you a little bit tonight about joint replacement. We're going to talk about some of the reasons we do joint replacement and what's involved and what's new with joint replacement. Before we get started, I'd like to tell you a little bit about myself. I'm an orthopedic surgeon which specializes in joint replacement surgery, mostly hip and knee replacement. I've been doing this for about 10 or 11 years. I perform about 500 joint replacement surgery per year. And at the Center for Hip and Knee Surgery in Mooresville, we do literally several thousand joint replacements per year. I love what I do, and hopefully we can get to know each other tonight and answer some of your questions about hip and knee replacement surgery. So let's talk first about what is joint replacement and why we do it. Joint replacement is a surgery where we replace a damaged joint with a new implant made out of metal and plastic. There are many types of joint replacement, and we can talk a little bit about those as well, but let's talk about why we do it first. Typically, we replace joints for pain, typically due to arthritis. There are some other reasons which we can talk about at a later time, but arthritis is the most common reason for joint replacement. The joints that we most commonly replace are the hip and the knee, and typically knees outnumber hip replacements by about 3 to 1. Over 66 million patients who suffer from arthritis each year. It can be a debilitating problem, causes pain, depression, limitation in activities. So what exactly is arthritis? Well, arthritis is a breakdown of the cartilage in your joints. Healthy joints have a smooth, pearly white layer of cartilage on the ends that is very slippery and lets the knee or hip move easily and without pain. As arthritis attacks those joints, it breaks down the cartilage, it becomes thin and rough and pitted, and the joint no longer moves smoothly. It releases inflammation into the joint, and that's what causes the pain and the swelling that you may have. As you can see on the image, a healthy joint has a smooth, white, pearly covering of cartilage. A joint injured by arthritis has rough, pitted cartilage and even areas of bare bone. This can be very painful and cause the knee to be stiff, swollen, and limit people's activities. So during joint replacement, we remove that damaged bone and cartilage. We don't take a huge chunk of bone, as people might think. We actually just take about 9 or 10 millimeters from each end of the joint. And then we replace that with a metal implant. Typically they're made out of titanium or cobalt chrome with a plastic insert or bearing between them. I mentioned earlier that the most common joints replaced are typically the hip and the knee, with the knee being most commonly replaced. There are other joint replacements done, which we won't go into today, but things like the shoulder or the ankle can also be replaced as well. This slide shows a view of the knee from the front. You can see the pearly white cartilage of in this healthy knee. The ligaments help support and balance the knee, and we keep most of those ligaments when we do a joint replacement. So now I'm going to show you a short animation that shows some of the key anatomy points of a knee. Flashing right now on the video screen is the patella or kneecap. This tracks in a groove in the femur and lets you bend and straighten your knee. We're going to remove that. Flashing now is the femur or thigh bone. The fibula is the bone in the lower leg next to the tibia. And now we're going to look at the top of the tibia in cross-section. In pink, you see the meniscus or menisci. These are the cushioning cartilage in the knee, and these are very often affected by arthritis as well and become damaged and torn. The anterior cruciate ligament is in the center of the knee. You hear about that from athletes or football players tearing those. Typically, we do take that out at the time of surgery. The posterior cruciate ligament is often retained, as are the two ligaments on either side of the knee, the medial collateral ligament and the lateral collateral ligament. The next animation we'd like to show you is what happens to the knee once we do a knee replacement. As you can see, the knee in this animation does not have any smooth pearly white cartilage left. It's rough and pitted, as we discussed before. We remove the damaged ends of the bone, the femur and the tibia, and then replace them with implants made out of metal, and then a bearing, usually made out of a high-grade surgical plastic, sits in between the two metal implants. So I'd like to show you some x-rays of one of my patients. He's a farmer, and he had very painful knees and came to see us. The x-rays in front of you now show the knees facing from the front, and you can see that there is no space between the femur and tibia. On a normal healthy knee, we would be able to see a dark space between the two white bones, and that's where healthy cartilage lives. As you can see, his cartilage is almost completely gone. He has bone spurs, which are another sign that there's arthritis present in the joint, and he was miserable. He was unable to do the work he needed to do around his farm. He was not enjoying his quality of life at all. The next x-ray is him after his surgery. We just saw him recently in follow-up. He now has both knees replaced. You can see the white of the metal implants on the x-ray, and then there's now a space in between the implants, and that's where the plastic lives. He is now able to do his activities around the farm. He's happier and living a better quality of life. Patients like him are the reason that I went into joint replacement. It's generally a very positive operation. It gets quality of life back for people who are miserable and unable to do activities that they want to do. All right, so now we've talked a little bit about knee replacement. Let's move on to hips and hip replacement surgery. So a hip is a very different joint from a knee. As you can ascertain, knees just tend to move forward and back, whereas hips have more of a circular motion. And a hip is a ball and socket joint, and you can see that on the animation. We have a socket in your pelvis with a ball that fits into that socket. Both of these, in a healthy joint, have a nice, smooth, pearly white covering of cartilage that again lets that hip move smoothly and without pain. As we develop arthritis in a hip joint, that cartilage starts to wear away, and again the hip becomes stiff and painful to move. Most patients typically describe groin pain, because that's where the hip joint is, actually in the groin crease. But very often this can radiate down the thigh, almost to the knee, or sometimes buttock pain can be described as well. So in a few minutes we'll show you an animation of a hip replacement, but essentially what we do is we remove the damaged ball and the damaged socket, place a new socket made out of metal with typically a plastic liner, and then a new ball down the inside of the femur or thigh bone so that you can get your smooth motion back and walk freely without pain. So there are many ways to do a hip replacement. Some surgeons go through the front in the anterior approach. Some people go through the side or back in a posterior approach. Here we have the ability to do all of these approaches. But regardless, we dislocate the femoral head from the socket or acetabulum and we remove it. We then place a new socket into the old one made out of metal. and you can see that being inserted here. We then put a new ball onto the end of the femur, and the way we do this is we have a metal implant that goes down the inside of the bone to hold it in place. In time, the bone will grow to these implants. Then we put everything back together, and patients can get back to life. When you come in and talk to a surgeon, they will discuss what approach they use and why, and which approach would be best for you, and also which implants they use and why. No two patients are the same, and we remember that when we schedule surgery. I had the pleasure of performing a hip replacement recently on a 70-year-old woman who still works. She is a seamstress, and she was finding it hard to do her job because of the pain in her hip. And she felt she was going to have to give it up because of her hip pain. We were able to replace her hip very recently, and after 6 weeks, she's already back at work and loving her new hip. These are her x-rays. You can see the hip with the arthritis has no space between the ball and the socket, while her other hip still has space left with healthy cartilage. And then after surgery, you can see the implant, the new metal socket with the plastic lining, and then the stem down the inside of the femur or thigh bone with the new ball all put back together. We have a great team here at Franciscan Health at the Center for Hip and Knee Surgery. We work closely with the medical doctors so that she has the best possible outcome. We work closely with nurses and physical therapists who are all part of our team, and we couldn't do the surgery without all of them involved. It's truly a team approach here at Franciscan. I'm frequently asked what are the benefits of joint replacement, and I think as you've gathered from some of our patient experiences that the number one benefit is relief of pain. And allows people to return to a high quality of life and do the activities that they couldn't do. And that's the number one reason we do this surgery, is to help people with their pain. The other question I'm often asked is, when is the right time to have a knee or a hip replacement? And that largely depends on you. So if you have hip or knee arthritis, and we can diagnose that with an x-ray, and you have failed other non-surgical management of your arthritis, and that's things like injections. Many of you will have had cortisone injections. Many of you will also have taken anti-inflammatories like Aleve and ibuprofen. Physical therapy often helps with knee and hip arthritis. And if none of these things are helping your pain and you're having a poor quality of life, then it's time to discuss hip and knee replacement with your surgeon. People get very concerned about what type of hip or knee replacement they should have, or what approach they should have. And when you're ready for hip and knee replacement, our recommendation is that you talk to an experienced surgeon. And we would define an experienced surgeon as someone who does 300 or more joint replacements a year. And don't be afraid to ask them that. And it should be done at an institution like Mooresville Center for Hip and Knee Surgery in the Franciscan, where we do literally thousands of joint replacements per year. Our studies have shown that patients are much less likely to have a complication from surgery in a hip and knee replacement center that does a large volume of total joint replacements. Patients often try a lot of other things to help with their hip and knee arthritis. Lifestyle changes are very common. People decrease their activities. Losing weight has also been shown to reduce the stress across a damaged hip or knee and can help with knee and arthritis pain. But eventually, at some point, people decide to proceed with hip and knee replacement surgery and commit to the process. We want you to be as healthy as possible. If you're diabetic, we would like you to have your sugars in control. We prefer that you don't smoke, and we prefer that if you can, lose weight before surgery. It will help you in your overall recovery and decrease your complication rate. People often ask if they're too heavy or possibly too young for hip and knee replacement, or even too old. And I want to reassure you that we treat each patient as an individual. We have very young patients that we've done hip and knee replacements on for quality of life reasons, but the younger you are as you have a hip or knee replacement, the more likely you are to need the hip or knee replacement redone in the future. So we always keep that in mind when we recommend hip or knee replacement surgery for our younger patients. Heavier patients often need hip or knee replacement surgery. However, they tend to have a higher complication rate, so we really recommend that most patients lose weight prior to surgery. So once you decide to undergo hip and knee replacement surgery, we would schedule your surgery, and then a week or two before the surgery, we have you evaluated by our medical doctors, because we want to make sure that you're safe and healthy enough to undergo the procedure. Then you'd show up at the hospital, we do the surgery. It takes us about an hour for a typical hip or knee replacement. and then we get you up and walking the very same day. The vast majority of our patients go home the next day, and some of our younger, healthier patients we're now even doing as an outpatient so they can recover at home. After you go home, you'll have physical therapy. You can either do that in the home or you can do that at an outside facility. And the recovery time for hip and knee replacements is about 6 weeks, although everybody's a little different. Some people move a little faster and some people move a little slower. Most patients have an excellent outcome after hip and knee replacement surgery, but we always worry about complications. And some of the more common complications are things like infection or possibly blood clots in the leg after surgery. At Franciscan, we work together to decrease the complication rate and make it as low as possible. And at the Center for Hip and Knee Surgery, our infection rate is less than 1%, whereas the national average is around 2 to 3%. So we're very proud of our work in that area. We're often asked what's new in joint replacement surgery, and there's always new things coming down the line, but not every new thing is a good thing, as I'm sure you are aware. One of the things that I'm most excited about has been the quicker recovery. In combination with our anesthesiologists and our physical therapists and nursing staff, we were able to get patients home a lot quicker, and they do a lot better than they did just a few years ago with a lot less pain after surgery. Incisions are smaller than they used to be. The implants are of much better quality. Though I would emphasize, let your surgeon pick the implant. You pick your surgeon and let the surgeon pick the implant, and you will do just fine. Partial knee replacement may be another option for you. If you have arthritis isolated to one part of the joint, then you may not need a complete knee replacement. The advantage of a partial knee replacement is it's a smaller implant with a quicker recovery time. As I mentioned previously, for some of our younger, healthier patients, outpatient knee or hip replacement may be an option. Really, the biggest benefit for hip and knee replacement surgery is quality of life. Our patients are able to get back to things that they love to do. And for everybody, that's different. For some people, it's shopping. Some people, it's golf, playing with their grandchildren, hiking, walking for exercise, traveling. All of these things our patients can do after hip and knee replacement surgery. And that's why I love what I do. Getting people back to their activities, back to a higher quality of life is extremely rewarding and makes it easy for me to come to work every day. I'd like to thank the online audience for attending today and for the people who could attend in person. Hopefully we were able to answer some of your questions and you got some useful information. Please feel free to reach out to us if there are any questions that we didn't answer, and hopefully we can get back to you with those. We appreciate you taking the time. Thank you.
Thank you so much, Dr. Williams. That was a great presentation. You've certainly given us hope that we can find relief from our joint pain. And to our webinar audience, thank you so much for joining us today. If you're ready to take the next step in considering joint replacement surgery, give us a call or visit us online at franciscanhealth.org. And again, if you have any questions, please send them to me, seminars@franciscanalliance.org. Have a blessed day.